And a lot of people that are watching this have chronic pain, and obviously migraine. But how does the role of the gut influence pain?
So, chronic pain is a very broad term. There are patients who have very specific causes for their pain, right? If you have an injured joint, shoulder joint, knee joint, you can develop changes that cause chronic pain, and that's localized to that. And that's generally not difficult to understand. And there are others where they have had nerve injuries and you get chronic pain from that. And that's not difficult to understand. Or patients who had prolapsed discs and chronic back pain. But then there's another category of patients where the pain is more generalized. It's not necessarily limited to one specific region. And these are what we call generally examples of neuropathic pain syndromes, where we believe the pain is coming not from the organ itself, although it appears to be coming from the organ. But the problem is not that there's anything wrong with the organ, but there is something wrong with the nerve. So it's like having a faulty fire alarm, right? Most often, when the fire alarm goes off, you're right in thinking that there's a fire or smoke. But when the fire alarm itself is faulty, the signal that it generates is the same. And your brain thinks there's pain, there's injury to that organ because it can't tell whether it's the fire alarm or the organ itself. So that's called neuropathic pain. And it's a very wide spectrum of disorders, but there's a lot of overlap. Patients who have widespread fibromyalgia, for instance, which is a kind of somatic pain that we think is neuropathic in nature. Patients who have irritable bowel syndrome, which we think is a form of neuropathic pain emanating from the bowels. And patients who have migraine. There's a lot of overlap. If you take any one of these, you take 100 patients with migraine, half or more will have irritable bowel syndrome kind of pain or irritable bowel syndrome. Half or more will have fibromyalgia. Conversely, you take 100 patients with fibromyalgia, you'll find a significant number have migraine and IBS, et cetera, et cetera. So people have traditionally gone to different specialists and been siloed into saying, this is fibromyalgia, this is migraine, this is IBS. But actually, if you take the big picture, we're dealing with a more widespread and more unifying diagnosis, which is neuropathic pain, right? So one way to explain how the gut is connected to migraine is to understand it as part of this more widespread neuropathic problem.